Hello, my name is Emily Houston. I'm a BSN student here at Athens State University. I did my poster presentation on medication reconciliation in intensive care units of a tertiary hospital in Saudi Arabia. The background of this is patients discharged from ICUs are at higher risk for medication discrepancies, which can harm the patients, increase healthcare costs, and lead to readmissions. The study that I chose aimed to describe the frequency and types of medication discrepancies among the ICU patients upon discharge, and it also identified factors associated with the medication discrepancies. The Pickett question I chose was, in adults patients taking multiple medications compared to those taking fewer medications, what is the effect of medication reconciliation on medication errors within a 3-month period? Patients discharged from ICUs are at higher risk for medication discrepancies. As mentioned above, they can cause potentially harm, increase healthcare costs, and lead to readmissions. And the study specifically aims to describe the frequency and types of medication discrepancies and how it's affected. For the procedure method, it's a qualitative study. It is a retrospective cohort study. It included patients greater than 18 years old, admitted to medical or surgical ICUs, and they were discharged on one or more medications. The data was collected through chart review over a 3-month period in the year of 2018. The medication discrepancy was defined as a difference identified between the documented home medications list and the medication list on the ICU discharge without any clearly documented justification. The participants of this study was done at a tertiary university hospital in Riyadh, Saudi Arabia, and as mentioned previously, the participants were 18 years and older, and most of them were female, as the mean age was 51 to plus or minus 15.7 years, so 57. The measures, the patient's chart reviews from the ICU admission to discharge. Also what was measured was the data was collected, as mentioned, a 3-month period in 2018. A statistical analysis software was used for conducting statistical tests, and the types of medication discrepancies were categorized. As you can see from my results, I did a table which specifically lists like the parameters of everything that was tested and the results. So the total of, there was 204 patients screened, but only 121 were included in this study. 216 medication discrepancies were identified. So about 23 or 19% patients were discharged without any medication discrepancies. So that means the rest were discharged and they had medication discrepancies. So in conclusion, this study underscores the importance of addressing medication discrepancies and suggests that a structured medication reconciliation process could be beneficial, but we would need further research. The research of the study provided several important implications to healthcare practice, policy, future research. The findings did highlight critical areas that the hospital needed improvement for patient safety, with the ICU discharge discrepancies. It needs to implement a systemic medication reconciliation process and to involve like multiple disciplinary teams, particularly pharmacists, which play a big role in reducing these discrepancies. And the main goal is to improve patient outcomes. And patient safety is always number one. Some limitations and future directions included the study was limited, a small sample size was used, and we could have used, which it produced little evidence, so we need more. And it was only obtained from one single tertiary university hospital. It was only collected over a 3-month period. So for future research, we need a larger, more diverse population and a longer study because it could capture more variability in the medication reconciliation practices, and there would potentially be a different result. In the end, the study did highlight the need for a systematic approach to medication reconciliation, suggesting, the potential impact of pharmacy-driven interventions and prompting future studies to test these methods. Down below, I have listed my acknowledgments, and I, Emily Houston, the corresponding author. Thank you for your time.